Yeah, binders are substances that you swallow orally and they stay in the GI tract collecting toxins. And so it's important they're not systemically absorbed. You would probably think of charcoal as the classic natural binder. And what they're doing is they're collecting toxins so you can excrete them through the stool. Because generally speaking, we have two main routes of excretion of toxins. You have the ability to excrete toxins in the stool, and then you have the ability to urinate out toxins um, after kidney metabolism. And it turns out it's pretty hard to influence kidney metabolism and the renal excretion, other than saying stay hydrated, right? Um, and so when looking to detoxify, we're kind of left with the GI tract, and that's where the binders come in. But
Mm.
I became fascinated about this after beginning to treat patients with mold. My mentor, Dr. Neil Nathan, introduced me to the use of binders, and I really just became fascinated by them, wondering if they had wider applicability to more patients. I found out they did, and I found out that just the answer of binders directly binding toxins in the GI tract for excretion was really only part of the way they worked. So I'll just, before I just keep babbling at you, does that all make sense, Lee?
Yeah, absolutely. Yeah.
Yeah. The the piece I see, one misunderstanding is people say that they have this idea of binders kind of traveling throughout the body, throughout the blood vessels and the lymphatic fluid, grabbing toxins. And it's important to remember that they really are just staying in the GI tract. And there's only a finite amount of toxins. If you think of mold toxins, if you're thinking of carcinogens, plastics, endotoxins, there's only a finite amount of toxins that are just hanging out in the gut, because for a person who's having regular bowel movements, right, there is a movement out. And so if you're just grabbing on the toxins that is inside the tube of the GI tract, you're not going to be able to have much improvement over time. But the neat thing is that the binders that I like to focus on in practice are things that are influencing the bile. So it turns out that a lot of toxins are stuck in what we call the enterohepatic recirculation, which is a huge word, but a simple concept. The body makes bile to digest food, right? And it's very expensive to make. So the body ends up reabsorbing a lot of the bile to repackage and reuse again, right? If you had to make all sorts of bile after every meal, you'd quickly run out and become nutrient deprived of the substances that it takes to make bile. So the body reabsorbs the bile, but the trick is that bile has the ability to grab onto toxins. Toxins cling to the outside edge. And so as the bile gets reabsorbed, the toxins can get reabsorbed. And then they hang out in the liver and they're excreted into the GI tract and then they're reabsorbed again. And that's the recirculation. It's one of the ways in which we can have a toxic burden grow in the body, right? Because we're constantly reabsorbing very small molecules like mold toxins. And so what I learned is that the binders that are working the best are really the ones that are directly grabbing onto bile itself, so it's not reabsorbed, or is able to impact how much bile is secreted, so we have the ability to grab onto more of those bile laden toxins to excrete. And so they're really fascinating binders clinical tools, and I think we're just scratching the surface of what we know about them.
Thanks for watching this video, and you can find the full-length podcast episode here on this channel, or you can head over to Apple Podcast or Spotify, and don't forget to like this video.